Hi, I'm Garrett. This is my barium enema trigger. First, I'm just going to go through how I have the room set up and all my supplies that I'm going to be using. We'll start with here is my barium enema, my barium bag. It'll be filled with barium and water, tied 24 inches above the level of the table. The tubing going across, and then at the end of it is the enema tip. We have the pump right here, going to be used for air, and then right here is going to be tied to it. Balloon inflator. This gets inflated once we're inserted into the rectum. What else? I also have my lead glove the radiologist may use during the fluoro exam, and the hemostat clamps used for to tie off the barium when administering is not wanted. We have our lubricant used prior to insertion, gloves for cleanliness, and towels. Obviously, can get messy. Next, I'm going to get my patient, explain to them the procedure, explain to them how everything's going to work, get a patient history, and also make sure that they followed all the dietary restriction methods, and get started. So that's what I'm going to get my patient right now. Out here. Ashley, come on in. So now I have my patient. I'm going to introduce myself and then double ID him to make sure we have the right person. Hi, so Ashley, my name is Garrett. Can you tell me your last name, please? And the doctor you're seeing today for this, or that ordered this, is Dr. Smith. Okay. So then I'm going to ask the patient, make sure that she followed all the dietary restrictions, including no solid food 2 days before the exam. Make sure that she followed the laxative instructions, and also if she needed to have some sort of cleansing enema before the exam, she went ahead and followed through with that. So after this communication, I'm going to have her come on over to the table, and we're going to start with the scalp film. So now I'm going to have her come on over to the table. Actually, you can have a seat on the table, please. Before we get started, is there any chance of pregnancy?
No.
No chance of pregnancy. Okay, so first what I'm going to do is start out with the scalp film. Just going to be a traditional KUB x-ray, where I'm going to center the crest, 14 by 17 film lengthwise, and my technique is about 70 kV at 15 to 20 mass. Okay, so now I have my patient on the table. We're going to do the scalp x-ray right now. So like I said, traditional KUB, lined up, 14 by 17, film in the bucky, and I can't really shield her ovaries for the KUB, so I have her shielded up on her breasts. Lined up at the crest, and that's it, x-ray. Okay, so when that's done, I'm going to go get the doctor, show him the scalp film, and have him come in, and then we're going to get the exam started. So I've gone and gotten my doctor now. My doctor's in the room. So next I'm going to have my patient get in the Sims position so we can do the tipping. Tip this. Alright, Ashley, go ahead and roll onto your stomach. Sims position's involved with her kind of on in an LAO position somewhat, with her right leg curled up. So now I have my patient in the Sims position. My doctor's in the room, and we're ready to start the tipping. So first we're going to have our enema tip lubed up, gloved. So yeah, we're gloved up, lubed up, and we're going to insert the enema into the rectum at for 4 inches in, and then we're going to inflate the balloon to seal off any leakage barium, I guess. So now all the barium's been administered, and we're just time to start doing our overheads. So the first one I'm going to do is just a PA over the abdomen. So I have a 14 by 17 film in here, set at about 40-inch distance. We're centered perpendicular to the crests, and we're going to use a KV of like 90 at about 16. We need at least 90 to penetrate the barium. So I'm going to have her shielded up here over her top half to shield her breasts, because I can't really shield her ovaries for this exam. And that's that. So I'm going to shoot that one. That's the x-ray. Okay, then the next one I'm going to do is a PA axial, where I'm going to come down here and angle caudally at 30 to 40 degrees. For this one, I'm going to be centered at the as-is. I'm centered at the as-is and lined up, Bucky 14 by 17. This one I'm going to do 90, a little bit higher mass, maybe like 20. And that's that. I'm going to shoot that one. And then go on to the next one. Is an RAO position where I'm going to have her angled in, the right shoulder in or left shoulder up, like that. Her body angle is about 35 to 45 degrees off the table. I'm centered again at the crest. No angle on my team now. Lined up on my Bucky. I'm centered at the crest. And I'm going to shoot that one X-ray. For this technique, I'm going to use something like 90 at about 16, very similar to the PA. Next, I'm going to go into an LAO. Very similar. She's just going to roll over and do the exact same thing, but the opposite side, 35 to 45 degrees up. Going to be perpendicular to the crest, lined up on a 14 by 17, and same technique. I'm going to shoot that one. Next, since she's on her left side, I'm just going to have her roll on up to make it quick and easy under the left side lateral. Just reiterating, I did have her shielded on that last one. I'm going to have her shielded on this one too. Shield her breasts. For this one though, I'm going to switch over to a 10 by 12 size film. So, done that. I have a 10 by 12 in here now. I'm perpendicular with my central array at the as-is again. And I'm going to shoot that one right there. I'm going to go up on my mass for this technique, so I'll be at like a 90 kV. I'm at a 25 mass, 25 to 28, 30 mass. Okay, now that we did our left lateral rectum, on the 10 by 12, we're going to do the left lateral DQ cross table lateral image. This is going to show the barium pooled to the left side of the body, which she's laying on her left side. So I have my tube set up pointing lateral across the table with a 14 by 17 film in the grid. Have her laying on her left side in true lateral, and I have the central ray is centered right at the crest, right here. My technique is going to be about 90 kVp at a 16 mass, and that is it. I will shoot that one. Oh, first off, I do have her shielded again up here, shielding your breasts, and I will shoot that one. It's an X-ray. Next, I will just have her quickly roll over. I'm going to run that film, get a new 14 by in the grid. She's rolling over, and now I'm going to shoot a right lateral. Again, shielding your breast. Pretty much the same thing, just lined up at the crest again, shooting across table lateral. Same technique, 90 at about 16, and I will shoot that X-ray. Alright, so now that we've done all our other overhead images, we're now going to do the last one. So the chancellor supine image, where the patient is bent over at the waist. We're shooting in perpendicularly at the lumbosacral region. We have a 14 by 17 inch cassette in the Bucky. By the way, this is a post-evac exam, so it's after the patient has gotten rid of all the barium. The technique is going to be higher in the mass, or maybe a 90 kV, but the mass is probably around 30. And that's it. And I'm going to shield over the breasts right here. And that's it. X-ray. Okay, now we're just going to go over the overhead images we just obtained. Going to go through all the criteria to make sure that we got good images. So the first one we'll talk about is this KUB film. It was our scout when we took before administering the barium. In a typical KUB, we want to make sure we look at the kidneys, the ureter, and the bladder down here at the bottom. This one we're just kind of looking at the whole abdomen just as a preliminary image before we administer the barium. We want to make sure that we don't have rotation, as evidenced by the crests right here, looking symmetrical. Also the nice vertical vertebrae right there in the center. So that's our scalp film. This next one, this was the PA projection that we did of the large intestine after the barium was administered. This one we want to make sure it demonstrates the whole entire large intestine. There should be no rotation, as evidenced again by the symmetrical looking crests. And yeah, this is one that just looks at the whole entire large intestine as a whole. Right after we've administered the barium. This is our first overhead that we take. The next one actually is one I could not find, but it's the axial projection, PA axial projection. Basically with that one there should again be no rotation, as evidenced by those symmetrical appearance of the hips. But with this one, the rectal and sigmoid colons, which is going to be down in here, should be elongated unless superimposed than on the PA. And that's basically the only difference with that one, is that elongation of that of the terminal part of the large intestine. The next one we will talk about is the obliques. This one we'll talk about the RAO first. In the RAO, this one's going to demonstrate mainly the ascending colon, which is going to be right here, and also the right colic flexure. That's what this one's going to primarily demonstrate, whereas the LAO, which we'll see right here, is going to demonstrate the opposite. It's going to demonstrate the left colic flexure along with the descending colon, and those are the obliques. Those are what the obliques are trying to demonstrate. The RAO and the LAO demonstrating opposite colic flexures, as well as one demonstrating the ascending and one demonstrating the descending colon. The next one we'll talk about is the lateral D cube, as we'll see right here. With the lateral D cube, this one should demonstrate the entire large colon, or the entire large intestine, excuse me. No rotation is evidenced by the symmetrical wings of the ileum again, right here, symmetrical crests. So for this one is especially useful for evaluating polyps, other such things in the large intestine, because we can see how the barium pools in each side of the large intestine down here. We also will occasionally flip them over and have them lay on the opposite side to demonstrate the barium pooling in the other side of the colon. And is that one. Last one we're going to talk about is this one, the lateral rectum. This shows the rectosigmoid area. Just the main part. There should be an image right here. Zoom in on it a little bit. Should be no rotations again. And yeah, this one just demonstrates everything in the ending of the large intestine, the whole rectum area, sigmoid colon, and rectum. And that is that. That is the evaluation of our images.